My name is Dr. Hameed Miyan. I am practicing physician and diabetologist in north part of Bangalore. So basically, today's topic is about heartburn, GERD, and gastritis. So number one, why this heartburn happens? Mainly, the heartburn happens because of acid reflux towards upwards towards our esophagus. So because of this acid reflux towards esophagus, so that's why the heartburn happens. So this heartburn, if it's not treated on time, may convert it into reflex disorder. So that is called as a GERD, GERD, gastroesophageal reflex disorder. So basically for the heartburn, so what do we advise for the patient? If the patient is on any kind of a long-standing medicine for any other illness, it could be diabetes, it could be BP, or it could be any heart-related issues or any long-standing medical illness patients. So such patients, what is my advice is, so number one, to take an antacid. So before he takes other tablets, so before taking an antacid, after taking an antacid, he should make sure that he will not have any other medicine or any other food for next 30 minutes. So after taking these tablets, then he can start his food or he can start his other tablets. So suppose timely, if those tablets are not taken properly, if antacids are not taken properly on time, this may get converted into a GERD, gastroesophageal reflux disorder. So once the heartburn is not treated on time, this heartburn may get converted into GERD. So what will happen in the GERD? So in GERD, what will happen? So there will be erosive gastritis at the esophageal end, and where the stomach and esophagus attaches. So there lot of erosion will happen. So lot of soft tissues will get lost. So because of continuous gastric acid production by stomach, and that gastric acid will be reflecting upwards towards our esophagus. Since the esophagus and stomach join, so there is a narrow passage. So because of this narrowing of this passage, so this acid will not come upwards. So in this narrow passage, so there will be a lot of erosion will happen. So because of this, so whenever the person he takes food, so if he lies down immediately after taking a food, so there will be kind of a reflex upwards. It may come up to our throat level, or sometimes may get a small quantity of vomit also. So in that vomit, so there will be majorly a water content will be there, or some kind of a bile content will be there, and there will be less of food contents will be there. So if this gastroesophageal reflux disorder is not corrected timely, may lead to into other complications. So to correct the gastroesophageal reflux disorder, so they have to take on H1 inhibitor along with the prokinetic drugs. So nowadays in combination we are getting prokinetic drugs with proton pump inhibitors. So prokinetics and proton pump inhibitor combination can be taken before food to suppress the reflex disorder. Even here also you have to take this prokinetic and proton pump inhibitor at least 30 minutes prior to your meal. So while taking this tablet, we should have to advise the patient to not to consume full meal. So again, he should consume in a split meal pattern. So rather than taking a full quantity of food, so he can cut down his meal pattern. Like he has to go for a small quantity of food, and he has to reduce spicy foods and all. He has to reduce a lot of masala items. So then he has to have food on time. So having food on time is a very good. Having food on time is a very big challenge nowadays. So in our day-to-day practice, so we have to advise the patient, especially to have food on time. So especially those who are in a working age group. So in working age group, to have food on time is the biggest challenge. So we need to motivate the patient to have food on time, and plus to restrict all kind of beverages. So any beverages which is available in our market, like all colas, all other drinks and all, has to be restricted. Even the tea, coffees has to be restricted. Even any if the person is consuming alcohol, I mean we should advise the patient to cut down his alcohol levels. If the patient is a smoker, even for a smoking also, even for a smokers also, we need to advise the patient to not to smoke, and he has to stop smoking. And second thing, the patient is addicted to any kind of a chewing tobaccos and all. Even we need to advise the patient to avoid some kind of a chewing tobacco, not some kind of a chewing tobacco, all kind of a chewing tobaccos has to be avoided. And secondly, the oily food and junk food has to be restricted. And after having a food, so neither the patient has to sit on the sofa, neither has to lie down. So we need to advise the patient not to sit or not to lie down immediately after having a meal for next 30 minutes. So we need to advise the patient to just take a gentle walk if he's in house, or if he's in walking also, let him take a gentle walk. Suppose if he's a desk job, so we have to advise the patient, if he's having a time, so let him stand for 10 minutes and do the work. So those things can be advised by a doctor to a patient. And next, and he has to consume lot of water. So immediately after a meal, so he is not supposed to drink even a cup of water for next one 10 minutes. Sorry, next one 30 minutes, next one 60 minutes is not supposed to drink. So after 60 minutes, we can tell him to drink some water. And meantime, so if the patient is on any kind of medicines, so he has to take medicine 30 minutes after meal for any other illnesses. So those kind of a small things we need to avoid. We need to advise the patient. Again, we need to tell the patient to take a gentle walk, and every day morning he has to develop in physical activities. He has to develop an habit of doing some kind of physical activities. So some kind of a physical activities, it depends upon the patient. So it could be walking, it could be running, it could be cycling, it could be swimming, it could be Zumba, it could be dancing. So whatever the physical activities if the patient likes, or it could be playing some kind of outdoor sports. So that our outdoor sports also comes in physical activities. So again, we need to advise the patient to not to take too much of stress. Sometimes because of the stress, also a stress-induced gastritis may come. So again, we need to advise the patient to cut down his stress levels. And main thing, the sleeping pattern has to be regularized. Again, we need to advise the patient to sleep on time, wake up on time, and maintain a regular timetable of our daily routine. So these are the things which we would like to convey through your media. Thank you very much.